Assalamu alaikum, this is Jahangir and you are watching Medical and Nursing Lectures. Dear learners, today I am going to present some multiple choice questions regarding fundamental of nursing. So here the question number 1 is, insomnia means option A, inability to walk, option B, unconsciousness, option C, inability to sleep, and the last option is inability to eat. Here the correct option is option C, inability to sleep. Question number 2. Dash the act of double checking or verifying data to confirm that it is accurate and factual. Option A, collection of data. Option B, validating data. Option C, subjective data. The other option is objective data, and the last option is baseline data. Here the correct option is validating data. Question number 3. A patient asks you which vitamin is best for the eyesight. Your response is vitamin A, vitamin C, vitamin B6 or vitamin B12. So as you know that vitamin A have a significant role in the eyesight, so here the option A is the correct one. Question number 4. What are the 3 components of nursing diagnosis? Patient etiology, sign and symptoms, patient problem, sign and symptoms, problem etiology, sign and symptoms, physical assessment, etiology, sign and symptoms, physical assessment, interviewing, observation. Here the correct option is option C, problem, etiology, sign and symptoms. It is also known as PES. Question number 5. A patient had hip surgery 16 hours ago. During the previous shift, the patient had 40 ml of drainage and the surgical drainage collection device for an 8-hour period. The nurse refers to the written plan of care, noting that the healthcare provider is to be notified when drainage in the device exceeds 100 ml for the day. On entering the room, the nurse looks at the device and carefully notes the amount of drainage currently in it. This is an example of assessment, diagnosis, planning, evaluation, and intervention. So here the correct option is evaluation. Question number 6. Perform to identify a life-threatening problem, choking, stab wound, and heart attack. Option A, initial assessment. Option B, emergency assessment. Option C, focus assessment. Option D, time-lapse assessment. The last option is none of the above. So here the correct option is emergency assessment. This kind of patient which have had a heart attack, choking or stab wound, we do emergency assessment on them. Question number 7. The planning step of the nursing process include option A, assessing and diagnosis, option B, evaluating goals achievement, option C, performing nursing actions and documenting them, option D, setting goals and selecting interventions. Option E, both A and B. Here the correct option is option D, setting goals and selecting interventions. Question number 4. Question number 8. The systematic problem solving approach towards providing individualized nursing care is known as nursing process, nursing assessment, nursing diagnosis, Nursing Practice Act, nursing intervention. Here the correct option is nursing process, in which we do first assessment of the patient, then nursing diagnosis, followed by the planning, and then we apply some intervention, and in the last we evaluate the nursing process. Question number 9. This association was established to develop, refine, and promote taxonomy of nursing diagnostic terminology used by nurses. North American Nursing Diagnosis Association, NANDA. Option B, Pakistan Nurses Federation. Option C, American Nurses Association. Option D, Ethical Nursing Association. The last option is Canadian Nurses Association. Option A is the correct one. North American Nursing Diagnosis Association, NANDA. Question number 10. Assessment that focuses on past medical history, family history, the reason for admission, current medications, previous hospitalization, surgeries, psychological assessment, nutrition, complete physical assessment. Option A is initial assessment. Option B, physical assessment. Option C, focus assessment. Option D, emergency assessment. So here option A is the correct one. In initial assessment, we do all the above things which we mentioned. Question number 11. Based on knowledge of peptic ulcer disease PUD, the nurse anticipates the presence of which bacteria when reviewing the laboratory data for a patient suspected of having PUD, peptic ulcer disease. Micrococcus, Staphylococcus, Corynebacterium, Helicobacter pylori. So here the correct option is option D, H. pylori, which is also called Helicobacter pylori. Question number 12. Which of the following are not energy yielding components of nutrients? Minerals, electrolytes, carbohydrates, proteins, both A and B. So as we know that minerals and electrolytes are although the components of nutrition, but they do not produce energy. So here option E is the correct one. Both minerals and electrolytes do not produce energy. Question number 13. In this step of the nursing process, you prioritize the diagnosis in order of importance and figure out what nursing interventions need to take place to accomplish these as well as goals to achieve your care plan. Option A, planning. Option B, assessment. Option C, diagnosis. And option D, intervention. Option E, evaluation. Here the correct option is planning. Question number 14. A patient on a surgical unit develops sudden shortness of breath and a drop in blood pressure. The staff respond, but the patient dies 30 minutes later. The manager on the nursing unit calls the staff involved in emergency response together. The staff discusses what occurred over the 30 minutes time frame, the actions taken, and whether other steps should have been implemented. The nurses in this situation are problem solving, showing humility, conducting reflective practice. The last option is exercising responsibility. Here the correct option is option C, conducting reflective practice. Question number 15. Which technique a nurse should apply first when examining the abdomen? Auscultation, inspection, palpation, percussion. During the physical examination, we apply the following 4 techniques while examining the abdomen. The first we apply the inspection technique on the patient. Question number 16. A patient is complaining of decreased frequency of bowel movement accompanied by prolonged or difficult passage of dry hard stool. The nurse will term this complaint is impaction, inspection, diarrhea, incontinence, both A and B. Here the correct option is option B, constipation. A nurse obtained the client's pulse, which is above the normal. The nurse document this finding is tachypnea, tachycardia, hypertension, arrhythmia, hypotension. The normal range of pulse ranges from 60 to 100. So if they exceed from the 100, which is above the normal, so that is known as tachycardia. Option B is the correct one. Question number 18. The point of the ethical principle to do no harm as an agreement to reassure the public that in always the healthcare team not only works to heal patients but agree to do this in the least painful and harmful way possible. Which principle describes this agreement? Beneficence, accountability, non-maleficence, respect for autonomy, fidelity. Here the correct option is option C, non-maleficence. Question number 19. A patient signals the nurse by turning on the call light. The nurse enters the room and finds the patient's drainage tube disconnected. 100 ml of fluid in the intravenous line and the patient asking to be turned. Which of the following does the nurse perform first? Reconnect the drainage tubing, inspect the condition of the IV dressing, improve the patient's comfort and turn onto her side, obtain the next IV fluid bag from the medication room. Here the correct option is inspect the condition of the IV dressing. Question number 20. Which of the following age group is most vulnerable for the sexual transmitted infection? Children, adolescents, mid-adults, early adults, older adults. Here the correct option is option B, adolescents, because they are sexually very active. So that is why there is a chance of getting sexual transmitted infections in this age group. Question number 21. Your body excretes waste products through which of the following systems? Gastrointestinal system, urinary system, cardiovascular system, respiratory system, both A and B. As we know that GIT system, the gastrointestinal system and the urinary system both are responsible for the excretion of waste products. So here option E is the correct one. Question number 22. Following are the factors which affect the bowel elimination except family social status, age, diet, fluid intake, all of the above. So all of the following factors can affect the elimination pattern except the family social status. So here option A is the correct one. Family social status is the only factor which cannot affect the patient elimination pattern. Question number 23. Which pulse should the nurse palpate during a rapid assessment of an unconscious male adult? Radial, carotid, brachial, femoral, and popliteal. Here the correct option is option B. Carotid pulse should be assessed by the nurse during the emergency or during the assessment of unconscious male adult. Question number 24. The nurse uses a stethoscope to auscultate a male patient's chest. Which assessment about a stethoscope with a bill and diaphragm is true? The bill detects high-pitched sounds best. The diaphragm detects high-pitched sounds best. The bill detects thrill best. The diaphragm detects low-pitched sounds best. Option B is the correct one. The diaphragm detects high-pitched sounds best. Which of the following system is maintaining your electrolytes, fluids and acid-base balance? Gastrointestinal system, cardiovascular system, urinary system, integumentary system, and nervous system. Here the correct option is option C, urinary system. Question number 26. Clients should be taught that repeatedly ignoring the sensation of needing to defecate could result in which of the following? Constipation, diarrhea, incontinence, or hemorrhoids. So option A is the correct one. Question number 27. Which statement provides evidence that an older adult who is prone to constipation is in need of further teaching? Option A. I need to drink 1.5 to 2 quarts of liquid each day. I need to take a laxative such as milk of magnesia, or if I don't have a bowel movement every day. Option C. If my bowel pattern changes on its own, I should call you. Option D. Eating my meals at regular times is likely to result in regular bowel movements. Here, option B is the correct one. If a patient is telling you that I need to take a laxative such as milk magnesia, or I don't have a bowel movement every day, so this kind of patient need further teaching. Question number 28. Which of the following is most likely to validate that a client is experiencing intestinal bleeding? Large quantities of fat mixed with pale yellow liquid stool, brown firm stool, semi-soft dark colored stools, narrow pencil-shaped stool. The correct option is option C, semi-soft dark colored stool. Option C is the correct one, semi-soft dark colored stool. Question number 29. A nurse is talking with a client who reports constipation. When the nurse discusses dietary changes that can help prevent constipation, which of the following foods should the nurse recommend? Macaroni and cheese, fresh food and whole wheat toast, rice pudding and ripe banana, roast chicken and white rice. Option B is the correct option. Fresh food and whole wheat toast should be recommended by the nurse, which relieves constipation. Question number 30. The nurse in charge is assessing a patient's abdomen. Which examination technique should the nurse use first? Auscultation, palpation, percussion, or inspection? So option D, inspection, is the correct one. Question number 31. The nurse in charge identifies a patient's responses to actual or potential health problems during which step of the nursing process? Assessment, nursing diagnosis, planning, evaluation. The correct option is nursing diagnosis. Question number 32. Nurse Nikki is revising a client's care plan. During which steps of the nursing process does such revision take place? Option A, assessment. Option B, nursing diagnosis. Option C, planning. Option D, evaluation. So here the correct option is evaluation. Question number 33. If a blood pressure cuff is too small for a client blood pressure reading taken with such a cuff may do which of the following? Fail to show changes in blood pressure, produce a false high measurement, cause sciatic nerve damage, produce a false low measurement. So it produce a false high measurement. So while getting the or measuring the patient blood pressure, there should be an appropriate size, a BP cuff size. Question number 34. Nurse Elijah has been teaching a client about a high protein diet. The teaching is successful if the client identifies which meals is high in protein. Baked beans, hamburger and milk, spaghetti with cream sauce, broccoli and tea, bouillon, spinach and soda, chicken cutlets, spinach and soda. Here the option A is the correct one. Baked beans, hamburger and milk are rich in protein. Question number 35. A male client is admitted to the hospital with blunt chest trauma after a motor vehicle accident. The first nursing priority for this client would be to provide pain relief, encourage deep breathing and coughing, splint the chest wall with a pillow, and the last option is assist the client's airway. So option D is the correct one. The nurse should first assess the client's airway, then can perform the other actions. Question number 36. In which step of the nursing process does the nurse analyze data and identify client's problems? Assessment, diagnosis, planning outcomes, evaluation. The correct option is option B, diagnosis. Question number 37. In which phase of the nursing process does the nurse decide whether her actions have successfully treated the client's health problem? Assessment, diagnosis, planning outcomes, evaluation. The correct option is evaluation. Question number 38. Which statement made by an adult patient demonstrates understanding of healthy nutrition teaching? I need to stop eating red meat. I will increase the servings of fruit juice to 4 a day. I will make sure that I eat a balanced diet and exercise regularly. I will not eat so many dark green vegetables and eat more yellow vegetables. Here the correct option is option C, which is I will make sure that I eat a balanced diet and exercise regularly. Question number 39. The nurse teaches a patient who has had surgery to increase which nutrient to help with tissue repair? Fat, protein, vitamins, carbohydrate. Here the correct option is option B, protein. Question number 40. The catheter of the patient receiving parenteral nutrition (PN) becomes occluded. Place the steps for caring for the occluded catheter in the order in which the nurse would perform them. Attempt to aspirate a clot, temporarily stop the infusion, flush the line with saline or heparin, use a thrombolytic agent if ordered or per protocol. So here the sequence would be, first of all, the nurse should temporarily stop the infusion, then flush the line with saline or heparin. Then the nurse should attempt to aspirate a clot, and in the last use a thrombolytic agent if ordered or per protocol. Question number 41. A patient asks for a copy of her medical record. The best response by the nurse is to state that only her family may read the record, indicate that she has the right to read her record. Option C, tell her that she is not allowed to read her record. And the last option is option D, explain that only healthcare workers have access to her record. Here, option B is the correct one, which states that indicate that she has the right to read her record. Option B is the correct one. Question number 42. The nurse is assessing a patient receiving enteral feeding via a small bore nasogastric tube. Which assessment findings need further intervention? Gastric pH of 4 during placement, check. Weight gain of 1 pound over the course of a week. Active bowel sounds in the 4 abdominal quadrants. The last option is option D, gastric residual aspirate of 350 ml for the second consecutive time. Here the correct option is option D. The patient need further intervention if the gastric residual aspirate of 30 ml for the second consecutive time. Question 43. Which statement made by a patient of a 2-month-old infant require further education? I will continue to use formula for the baby until he is at least a year old. I will make sure that I purchase iron fortified formula. I will start feeding the baby cereal at 4 months. The last option is I am going to alternate formula with whole milk starting next month. Here the correct option is option D. I am going to alternate formula with whole milk starting next month. Question number 44. Early assessment of the client input and output chart is the example of initial assessment, focus or ongoing assessment, emergency assessment. The last option is time-lapse assessment. So here the correct option is option B, focus or ongoing assessment. Question number 45. Is a clinical judgment about individual, family or community response to actual and potential health problems, life processes. Option A, nursing diagnosis. Option B, nursing assessment. Option C, planning. Option D, evaluation. And the last option is option E, implementation. So here option A is the correct one. Nursing diagnosis is a clinical judgment about individual, family or community response to actual and potential health problems or life processes. Thank you for watching. Please subscribe the channel and press the bell icon for getting the upcoming videos.